This is the annual report from Trillium Resources, and Dave Peterson's here for that.
Mr. Peterson, thank you so much for agreeing to accommodate us this evening and bring us up to date. I appreciate Vice Chairman Overman reaching out to you, and we look forward to your report.
Thank you, Chairman. And before I get started, I really do want to thank Dare County, because Trillium is in 25 counties, and the services and supports that Dare County gives to people with mental illness, substance abuse, and developmental disabilities is very strong in this county. So I want to thank you all for all the support that you've given those three groups. I also want to thank Commissioner Overman, who serves on our governing board. He's done a wonderful job. I think he's in his third year of doing that, so we really appreciate that. And also Jay Burris, who sits on our regional advisory board, and he also is a very good advocate for Dare County. So I want to reach out and say thank you to both of them. So every year we have our annual report to each of the counties, and so let me start with giving you our mission. It's transforming lives of people in need by providing ready access to quality care. Although this is a very simple mission, it's not that easy to do with people with mental health, developmental disabilities, and substance abuse issues. So, and the face of our managed care organization is continually changing by budget cuts and federal requirements, and also the Medicaid reform that's happening in our state. We have to adapt and evolve to those changes as a managed care organization. And so we really want to support our boards and our regional advisory boards for helping us move forward with these changes. So one of the big issues that we have tried to address in this Medicaid reform is an announcement that came out on November 15th in trying to address the changes in the managed care of North Carolina. So what we have done is we've developed a partnership with Alliance and VIA, and those are two other managed care organizations in the central and the western part of the state. And it's we have a website called advancingnchwholehealth.com, and basically what this isn't is a merger. We want to make sure that gets clear. It's not a merger, but it is a way that the three managed care organizations with 52 counties can be ready for when the managed care comes down from the state. We can all be on the same page between the three managed care organizations to apply for when it comes out with this managed care plan. And so this collaborative effort between the three MCOs is just at a top level right now, and getting information and gathering information between the three on how they operate, and compare how we can better uniformly be applying for when the state comes out with what's called the targeted plan. So just a little bit of what we were last year. Since this is last year's annual report, we were 24 counties. We were the largest in geographic region. Total population of about 1.26 million. We had 185 Medicaid eligible people, which was about 13% of the state's total population and 13% of the Medicaid enrollees. As you can see, the square miles, 11,451 square miles that we cover with our 24 counties last year. And we widely vary in population. As you know, we are down in Wilmington or New Hanover County, and they're the 8th largest, but we also have Terrell County right next door, which is the smallest county in the state. So how to manage those different counties is one of the tasks that we have as regional directors. So in July of 2017, Nash County decided to join Trillium. They were at East Point, and so that increased our total population to 1.35 million, okay? The Medicaid eligibility went up 10,000, and we now are 14% of the total population and 16% of Medicaid enrollees. So we are now a total of 25 counties, which is, as everybody knows, 1/4 of the state. Every year, we do an annual gaps and needs analysis, and we gather information from a variety of resources. And if you're interested in that information, it's a large document, but it is on our website, and you can look it up at Gaps and Needs Report. We take a look at the national prevalence data, we take a look at the state data, but we also take a look at all the county data. And we try to make sure that we get information from a variety of resources, from county commissioners, from local stakeholders like DSS and public health and law enforcement. And then we put together this database that includes information from our consumer and family advisory committees and any consumers that we serve. And we come out with this annual gaps and needs report. If you're interested in that, you're more than welcome to take a look at that at our website. So just some current statistics for 2016. We served in our 25 counties approximately 52,650 people. 79% of those folks had a primary diagnosis of mental illness. 19% had substance use disorders, and 9% with intellectual and developmental disabilities. Total cost to serve those folks was about $355 million.
Dave, I had just a quick question
Yes.
on that slide. As I was reading it ahead of time, that works out to roughly $7,000 per person.
Yes.
However, in the three categories, which now have disappeared from my screen, mental health, disabilities, and substance abuse. Thank you, Steve. Thank you. Thank you. My only question was 80% of the folks are in the mental health category, and I didn't want to assume that there's some homogeneity of $7,000 per individual served across all three. So I was curious if it's, yes, 80% of the 50,000, but it's a small cost. The small percentage in the intellectual is a much higher cost.
Yes.
That's what I was searching for.
Yes, and you're exactly right, Commissioner, that in the developmental disability world, and I shouldn't say a majority, but many of the individuals with developmental disabilities need 24/7, 365 care.
Yeah, that's where I was going with it, because I thought it would be a much, much higher rate per person.
Yeah.
And I was curious if, I don't know if you have those, and it's not like I needed it, I was just curious.
Yeah, and so some of the other folks may need just some outpatient, once a week, once a month type of services. And that's where that kind of makes up the difference between the two. But yes, if you need additional information on how those are broken out, I can get that.
Yeah, as I said, it's not critical or anything, it was just a curiosity as I was reading your slide, that's all.
Yep,
Thank you.
good point. Okay. So at the end of that slide, it basically says that we have about 430 provider agencies throughout our 25 counties, and let me clarify that. We have agencies that hire several hundred people. We also have providers that are a single licensed clinician, okay, that do outpatient therapy, and that's included in that 430 approximately. So some of the priorities, we have 5 priorities as an agency. We want to make sure that we're improving our customer service. We want to make sure that we're addressing evidence-based practices. We are taking a look at strengthening our use of technology. We want to make sure that we're improving our community relationships through advisory boards and system of care. kind of like presenting like this to you all to build those relationships. And Commissioner Overman chairs the Saving Lives Task Force, and I sit on that task force in that group. So we want to make sure we're staying connected to the community, but also we want to make sure with all our departments we're functioning as one. And so that means a lot of communication has to take place between our department groups. One of the big topics that everybody is very, very aware of is the opioid crisis. And so the state of North Carolina last year received $31 million, and it's called the Cures Act. And that money is spread out throughout the state, and it's a 2-year, one-time funding. Okay? The first year, Trillium received $1.2 million. And this is for individuals seeking opioid treatment, okay? And they need to be first-time opioid treatment seekers or someone that is currently not receiving services at all. And so that money is directly tied to those folks. Yes, Commissioner.
Dave, again, I apologize
No
for
problem.
interrupting. I saw this, and correct me if I'm wrong, my reaction was, this is nothing.
I would, yes.
I mean, I'm
So,
looking at a $350 million cost on the previous slide.
yeah,
50-some thousand folks affected, treated, dealing with Trillium, and we have all of 1.2 million to Trillium serving 25 counties, and I think it was 14 or 15% of the state's population.
yes, yes. So,
Big trouble.
yes. So let me,
Say that again, Danny?
Markets with big trouble, not to single out New Hanover or any of these
Yes.
others, but they've got some real problems in some areas.
So let me give you some pieces of fact. Wilmington got named #1 in the country, not New York City, not Chicago, not LA. Wilmington got #1 in the country for opioid abuse in 2015. Okay? That being said, we should, since it's a 2-year grant, the 1.2 million, we should be getting some more money this next fiscal year. How much that will be utilized? Well, let me go to the next slide, and that will give you a little bit more information. The first 6 months, okay, we used our $1.2 million serving 1,269 individuals with a primary diagnosis of opioid abuse. Okay? Now, hopefully with this data that we've given to the state, and if you look at the map of opioid abuse across the state, western part of the state looks really bad, and the eastern part of the state looks really bad. Central part of the state, not as bad, but every death is bad. Okay, so hopefully what will happen in this second year of the grant, we will get more because we ran out of that money in 6 months. Yeah. So the good thing that is happening, the Saving Lives Task Force has been on top of this and having these forums every quarter addressing all the drug issues that are coming out of Dare County. The other counties are also starting to have opioid forums. And one of the most powerful things, and I've attended probably 7 or 8 of them now, one of the most powerful things in those opioid forums is they are not blaming a certain party. They're not saying, oh, this is a school issue or a sheriff department issue or a hospital issue or a social services issue or a treatment provider issue. They are saying this is a community issue. And they are coming up with trying to solve this problem in their community. And that's one of the most powerful things I've seen in several years, communities trying to address this issue. And Dare County has been doing a phenomenal job of addressing that with their forums. Education is happening all the time in Dare County around this issue. But getting back to your point, the funding of this is minimal. And we are needing a lot more money from the federal government in order to address this issue, to stop the opioid deaths, to try to make sure that folks have good access to treatment and services, and to really educate all facets of our community about this issue. So with what we've been trying to do with this, okay, we have purchased beds at the Healing Transitions in Raleigh. And last year we had 354 admissions from folks from the Trillium catchment area at that facility in Raleigh. We have had 242 people being served in sober living homes called the Oxford Houses. We have the North Carolina Harm Reduction Coalition, where we have funded naloxone kits. And I know that Dare County has been very adamant on making sure the Sheriff's Department has access to naloxone kits and doing a wonderful job with that. And so we want to try to make sure that we're helping with that distribution of naloxone kits. We have wellness cities in Greenville, Wilmington, and New Bern that provides peer support services to a lot of people in recovery. We also just got donated 10,000 medication disposal kits. In other words, if people are trying to empty out their medicine cabinet before the kids get into them or adults get into them, there's these kits that can dispose of the medication in your cabinets. Other initiatives that are addressing advancing technology, we have a comprehensive assessment for teens. We also have what's called Crisis Chat, and it's an app. Kids don't like talking face-to-face anymore, okay? It's now an app where they can start talking to people through their phones, and it's been very successful so far. We have a lot of assistive technology to try to make sure people can stay in their homes if they're needing some extra help at their house. And we also have an access point kiosk, and we have one here in Dare County also. People are going in and doing screenings, and my main point to that one, if any of you have gone to the CVS to get your blood pressure done, okay, you should not feel any shame in also going to this access point kiosk and getting a mental health screening. Your blood pressure is the same thing as a mental health screening. Okay? So some of our reinvestment plan outcomes. We have had summer programs and after-school programs and respite programs, and we have one right here in Dare County that has been very successful. And this past year, we had 380 youth served through the day programs and 218 kids being served at the after-school programs. We have had accessible playgrounds, and as you know, the one that we've had here, that's been a powerful tool to make sure that people are accessing friends and family and getting to know each other on the playgrounds. Two quick stories. In Terrell County, the one right next to the assisted living, if you drive by there, that's an accessible playground that we paid for. 80-year-old woman came out from the assisted living, and been in a wheelchair all her life, got on the swing set that allows people in wheelchairs, and started crying for the first time. She's never been on a wheelchair. It's not just for kids,
Right.
okay? It's for anybody. Some other outcomes, Child First is it's an evidence-based practice that we adopted from Connecticut. We're the only other state that has put this into practice in the eastern part of the state, and it is from 0 to 5. And this also addresses the opioid issue. It's kids going through trauma. And so if their parents are using, these kids can receive services and supports in their home from a licensed clinician going into their home. And more, just as important, is a case manager helping them try to get other issues resolved in the home. So we've started that Child First about 2 years ago, and it's served 926 children. We did a direct course workforce development where we train, not us, it's an evidence-based training for people that are doing direct services to folks. And once they pass that class, they can better serve individuals, but we also gave them a one-time stipend to just get that training done. Compassion Reaction, the Rachel's Challenge is very popular in Dare County. It's been very successful. I believe all of your elementary, middle, and high schools participated in the Rachel's Challenge events over the past 2 years. And so that's been very powerful. And going to some of the county meetings here, that group is still going and going strong. So we're very happy to see that. We have wellness recovery action plans, and these are by peers that give these classes on how to do your budget, how to address your self-esteem or your anger issues. And so we offer those classes in every county, and Dare County has those classes. We also have been offering mental health first aid training and crisis intervention training, and Dare County folks have taken advantage of those classes too. So for Dare County specific data, over in 2016-17 fiscal year, there was 1,221 individuals served. 871 had a primary diagnosis of mental health, 326 primary diagnosis of substance use, and 99 individuals with a primary diagnosis of intellectual and developmental disabilities. And so we have been having an impact here in Dare County with the services and supports. And so I want to once again thank you for all the support that this county has given the people that with intellectual and developmental disabilities, substance abuse, and mental health. Thank you. Any
Thank you,
questions?
Mr. Peterson. I appreciate you once again you being here. Is there any questions from the board?
Two things. What effort is being made to convince pharmaceutical companies to develop painkillers that are non-addictive?
I just read a letter that came out like 2 days ago that from the governor that went up to Washington that there's like 5 pieces of that letter, and one of them is to try to address that. If you take a look at the president's opioid plan, it's a very long document. There's 56 recommendations in there, and there's probably 4 or 5 of them that are addressing the pharmaceutical industries to go after exactly what you mentioned.
One other comment. One thing I think that would help in this particular fight is to convince physicians when they are prescribing, something for pain, to consider buccal films as the drug of choice. 2 reasons. Number one, much lower dose to get the same response. Mm-hmm. If the medication is buprenorphine, less likely to be abused. Okay.
Yeah.
So I think those are 2 things that need to be pursued in this fight against addiction.
Yeah, I would 100% agree. There's a lot of ways to tackle this, and we got to take it all in and see which ones will have the biggest impact the quickest, and then drill down to those other areas too.
Yeah.
Yep.
The buccal films are very hard to abuse, so, and they certainly are very active, and with a much lower dose to get the same pain relieving effects.
Yeah, I would agree.
Okay, thank you.
Thank you.
Thank you, Commissioner Shea. Anyone else? Dave, once again, thank you very much.
Thank you, Dave.
Appreciate you being here.
Thank you.